Hi, I've chosen to do my honors presentation on personality disorders. So some background on personality disorders. Personality disorders were first brought to light in the 1950s, and they were written and explained into the first diagnostic and statistical manual of mental health disorders. The first DSM was written in 1951 and published in 1952, and it listed 106 mental disorders. Personality disorders are defined as an Axis 2 category, and Axis 1 category is all other psychological illnesses, and then Axis 3 is general medical conditions. So to talk about some people who pioneered in the field of personality disorders, Felipe Pinal was a psychiatrist in the late 1700s to early 1800s. He was the first author to introduce a personality disorder, and he used the term mania without delusions. So mania means a state of agitation, and without delusions meant in Pinal's sense that the patients didn't present with abnormalities of understanding, memory, perception, judgment, and imagination. The next person I want to talk about was Emil Kraepelin, and he was a psychiatrist 100 years after Felipe Pinal, so he was in the late 1800s and early 1900s. He is known for introducing the term psychopathic personalities into the world of psychiatrists. So, Kraepelin said that psychopathic traits are an inborn defect, which means that psychopaths present with it their entire life and it gets worse over time. The pathological personalities, he first recognized 4 of them in his 7th edition of his textbook and then moved to 7 in his 8th edition. And those are the excitable, which would be someone with borderline personality disorder, and then the irresolute, which is persons who follow their instincts, like pleasure lovers and periodic drinkers. And then there's the eccentrics, the quarrelsome, pathological liars and swindlers, and then enemies of society. Moving on to the third person who actually talks about a lot the dimensional system. So that's Raymond Bernard Cattell, and he moved from the UK to the US to apply a statistical approach to personality disorders. He discovered 16 source traits which fit into his bipolar dimension of study. So he did use an alphabet to label his, and he only had 2 theories, so it was only A and B. But his B factor was used to measure general intelligence, which to us is an IQ, so an intelligence quotient. Today we know this has developed into a 5-factor theory. Moving on to some classification of personality disorders. So a lot of symptoms designated to different personality disorders do overlap, which leaves room for misdiagnosis and patients being diagnosed with multiple personality disorders. So today, psychologists use a categorical approach, but some researchers and clinicians are fighting to move towards the dimensional approach. So the categorical approach is either the patient does or doesn't possess that trait, which means they don't or do fit the category that they're looking for. On the other hand, the dimensional approach allows them to have different levels of certain characteristics, so they are able to measure whether they have these symptoms or they have the disorder in different ways. As stated in the textbook, personality disorders tend to differ more in their degree of symptoms and seriousness as opposed to varying in the type of dysfunction. So next I'm going to move on to the 3 types of classifications, which are odd, dramatic, and anxious. So first I want to start with odd personality disorders. And these are classified as eccentric behaviors. Eccentric to us means unconventional and slightly strange. The disorders under this category are similar in ways to schizophrenia, but they're not as extensive as schizophrenia. So the first diagnosis is paranoid personality disorder, and this comes with a patient deeply mistrusting other people and they're suspicious of their motives. So they believe that everyone intends to harm them, and they begin to excessively trust in their own ideas and abilities. They do try and find hidden meanings in everyday activities, events, and conversations. Even if the hidden meaning isn't there, it's made up in the paranoid person's mind. They do tend to be cold and distant and are extremely critical of others' weaknesses, and they try and find fault in them. They also do bear and hold grudges more so than other people. And these paranoid people don't typically seek treatment because they don't see themselves needing help. The second diagnosis under odd personality disorder is schizoid, And these are people who persistently avoid social relationships and events. They're removed from social relationships if they're a part of one, and they demonstrate little emotion in all scenarios. They're what psychologists consider to be loners, which means they always prefer to be alone. They show little to no interest in sexual relationships, friendships, and they feel very indifferently about their families. They just don't know whether to trust them or not. They're typically, but not always, unaffected by praise and criticism because they rarely show their feelings. Treatment for people diagnosed with schizoid is complicated because they're very reluctant to go, so they make little progress. The third diagnosis in odd personality disorders is schizotypal, and they display a wide range of interpersonal problems. They're extremely uncomfortable in relationships. They have very odd patterns of thinking and perceiving, and they do also display eccentric behaviors like the odd personality disorder itself. They display ideas of reference, and ideas of reference means that they believe that unrelated events pertain to their life and to themselves in a very important way. They also experience bodily illusions, so they feel like they are one or they have an external force or presence. When they are taking part in a conversation, they have difficulty keeping their attention, and the conversation is pretty much vague and general. They tend to work undemanding jobs, and an interesting fact about people with schizotypal personality disorder is half of them also have major depressive disorder, and their treatment is focused on reconnecting with the world, but is usually unsuccessful. The second category is dramatic personality disorders. And so these are more commonly diagnosed than either odd or anxious personality disorders. So the first diagnosis under this is antisocial personality disorder, which is extremely important. These people are what we refer to as psychopaths and sociopaths. So they're persistently disregarded, but they do tend to violate other people's rights. For someone to be diagnosed with antisocial personality disorder, they do have to be 18 years or older. So some facts about them: they're manipulative, they're absent-minded to the point that they can't hold a job, and they're careless with their money. They do show high impulses, and they're very reckless in their behavior, but they do pick weak victims when they are violent because they are self-centered and need to just have that control. Someone diagnosed as a psychopath or sociopath either displayed symptoms of or was diagnosed with conduct disorder or ADHD when they were in childhood. So some other significant factors are they're physically under-aroused, and they display higher rates of alcoholism and substance abuse disorder. Therapy for someone diagnosed with antisocial personality disorder is almost always unsuccessful because they lack a conscience, they don't have desire to change, and they have no respect for therapy itself. So the second diagnosis under dramatic personality disorders is borderline personality disorder. These are people who display a great instability, they have exaggerated changes in mood, they have an unstable self-image, and very high impulses as well. They present with self-harming behavior. They've either attempted suicide or they've had many thoughts about it. They put themselves into relationships socially and sexually that are conflicting and intense, and the feelings usually not mutual towards their other party. Like the category they're under, they have dramatic identity shifts. So treatment-wise, there has been some improvements with psychotherapy, but they also try to use dialectical behavior therapy. So the third diagnosis under dramatic personality disorders is histrionic personality disorders, which is someone who's extremely emotional, which means they're emotionally charged, and they continually seek to be the center of attention. So the main traits are exaggerated moods and neediness. They tend to live their life like they're on stage using theatrical manners, languages, and gestures. They always need praise and approval, so they're demanding and self-centered. In order to get attention, they do tend to behave provocatively, which is why this is found more in women than men. Someone diagnosed is likely to go to therapy on their own, but they go with unmeetable needs and they throw tantrums the whole time that they're there. The fourth and final diagnosis under dramatic personality disorders is narcissism. They are generally grandiose, which means that they feel really good about themselves. They feel no empathy for others, and they are constantly seeking the admiration that they want. They have conceived themselves of their own great success, power, and beauty, so they expect other people to admire them the same as they admire themselves. They're very self-absorbed, self-involved, self-centered, so they're just pretty much all about themselves. They do, when talking to others, exaggerate their achievements and talents to make themselves seem better, which makes them very arrogant in how special they are. Therapy doesn't work for narcissistic people because they're unable to acknowledge that they're not, like, the best. They're unable to take weakness, and they can't take negative feedback from a therapist. So moving on to the next category is anxious personality disorders. So anyone with an anxious personality disorder has high fear behavior and high anxious behavior. The first diagnosis under this category is avoidant personality disorder. And this is someone who's very uncomfortable and inhibited in social situations. They're typically overwhelmed by feelings of inadequacy, and they're extremely sensitive to negative evaluation from others. So they're fearful of being rejected, they dread criticism, disapproval, and then they're always, not always, but they're most of the time unappealing to others, and they feel inferior to those around them. They go to therapy hoping to find affection and acceptance, but they start to skip sessions because they get nervous, so the therapist cannot typically gain their trust. The second diagnosis under this category is dependent personality disorder. Someone with this disorder has an excessive need to be taken care of, and so they're very persuasive in order to get that level of affection. They fear separation and abandonment, so they're constantly clingy and obedient. Therapy is very unsuccessful because they place the treatment completely on the therapist, but a major part of therapy is being able to take responsibility as the patient for what you need to have done, but someone with dependent personality disorder cannot do this. So the last diagnosis under anxious personality disorder is obsessive compulsive disorder, which we talked about earlier in the semester. These people are preoccupied with order, perfection, and control, so they typically lose all flexibility, openness, and efficiency. They set unreasonably high standards for themselves and for those around them, and they have a really strict personal code, so they're very rigid and stubborn in their morals, values, and ethics. They're unable to see what's wrong with them, so they don't seek therapy, but they typically do seek therapy if they're diagnosed with another mental disorder or some sort of physical disorder. So next, I wanted to talk about the neglect of multicultural factors. I found this very interesting when reading it in the book. So multicultural factors in the psychology field and in relation to personality disorders are typically neglected and overlooked. But borderline personality is prominent in women. Like 75% of the patients diagnosed with borderline personality disorder are women. They typically develop BPD because of extreme traumas, and this is typically attributed to social inequalities like marginality, powerlessness, and social failure. Personality disorders are typically more common in Hispanic Americans, and one major thing that's commonly overlooked when diagnosing personality disorders is cultural differences. Like a white male and a Puerto Rican male may act the same in a certain situation, and for the white male to do that, it's not okay, and he probably does have a mental illness, but for the Puerto Rican, that's normal in his culture, and that's the behavior that they expect. The next part of my presentation goes over the Big Five theory of personality, and this displays 5 traits and factors that can be used to diagnose patients. So these include neuroticism, extroversion, openness to experiences, agreeableness, and conscientious. So neuroticism entails anxiety and hostility, whereas extroversion entails optimism and friendliness. According to psychologists who presented this idea, the patient would be ranked as low, medium, or high in each category, and they're diagnosed from there. The next part of my presentation goes over personality disorder trait specified. So this refers to people whose traits significantly impair their everyday functioning. To use this, they usually identify and list all the problematic traits, and then clinicians rate the severity of impairment. The 5 categories for this are really extensive and elaborate, so I just wanted to give a quick rundown. But the first one is negative affectivity, and this includes emotional lability, anxiousness, separation, insecurity, preservation, submissiveness, hostility, and a bunch of other things. So the second one is detachment, and this includes suspiciousness, withdrawal, and intimacy avoidance. And then the third one is antagonism, and this is manipulative, deceitful, grandiosity, attention-seeking. The fourth of these is disinhibition, which is irresponsibility, impulsivity, distractibility, risk-taking, all the things that kind of entail being irresponsible. And then the final of these 5 is psychotism, which is displayed by unusual beliefs and experiences, eccentricity, cognitive and perceptual dysregulation. So the last part of my presentation, I wanted to share a story that I found really interesting on borderline personality disorder. So Kayla was diagnosed with borderline personality disorder, which is present in only 2 to 3% of the population, but every 1 in 10 people that's diagnosed with it dies from it. So in 2007, she did attempt to drown herself in a lake, but she was unsuccessful in her suicide attempt. Her partner, Nigel, soon became her carer, and she referred to herself as a service user. She said she was prevented from having a normal childhood because early in life she had symptoms of separation anxiety, fear of abandonment, self-harm, and instability, which we talked about earlier, but all of these enabled her from connecting with her peers. She said around age 11, she started to fall behind in every aspect of life, so academically, socially, athletically, because she couldn't develop an identity. As treatment, she takes part in her local mind group and a program called Emergence. So Emergence works with the Department of Health to train people working with patients that have been diagnosed with borderline personality disorder, and this helps to better educate those people caring for them and the psychology behind it. Since she couldn't hold down a full-time job, which is part of being borderline personality disorder, she began working as a traveling musician. These are my references, and I will share the slides with you in a separate email. I hope you're staying safe. Thank you so much.